If you find yourself in a situation where you've had unprotected intercourse and you don't desire pregnancy, you can use something called emergency contraception. It's also called the morning after pill, and in the United States, the most common brand is something called Plan B. This is a progesterone. It's a medication called levonorgestrel, and it's either going to be packaged as one pill or two pills. The two-pill packaging tells you to take it 12 hours apart, but you can really just take the two pills all at once. And so you take the medication as soon as possible after the unprotected intercourse, and that will give you some protection against pregnancy. Unfortunately, it's not as good as most traditional birth control as far as its failure rate. The Plan B or emergency contraception only has a contraceptive benefit of between 80 and 90%. And that's pretty poor when you compare it to other birth control methods. For instance, birth control pills are about 98%, IUDs and implants are greater than 99%. So it really isn't the kind of thing that you want to rely on all the time. You really should take it within 72 hours of intercourse, and the earlier the better, because the earlier you take it, the less chance you're going to get pregnant. After those 72 hours, the effectiveness really drops off pretty quickly, but there has been shown to be some effectiveness even up to 5 days after intercourse. So if you find yourself 4.5 days after that unprotected intercourse, it still may be worthwhile to take the Plan B, even though there's more of a chance that it's not going to work. At least it gives you some protection. The Plan B works by inhibiting ovulation. In other words, if the ovary is about to make an egg, it will stop that process so that there's no egg for the sperm to encounter from the unprotected intercourse that you had. It does not work by causing an abortion. That's a common misconception. But the morning after pill or the Plan B or the emergency contraceptive, all synonyms, does not cause abortions. There's a different pill that can be used for abortions, but that's really used later on. And so this is not an abortifacient. It really works by blocking ovulation, and that's an important thing for people to understand. Another thing to think about if you get into the situation where you're using Plan B or emergency contraception is, how did I get here in the first place? Clearly, whatever your strategy is for avoiding pregnancy doesn't seem to be working well because your Plan A didn't work, or you wouldn't be going to a Plan B. So I think it's important that if you find yourself needing emergency contraception, you should probably make an appointment with your doctor to talk about better long-term contraceptive options. There are many things available for birth control that have a much higher success rate than the Plan B. And if you use the Plan B consistently or frequently, eventually it's going to fail and you're going to end up with an unintended pregnancy. The biggest side effect from Plan B is that your next period is likely to be irregular. And it's very unpredictable how that will be. The period may be late, it may be early, it may be light, it may be heavy, but chances are it's going to be somewhat irregular in one way or another. That's really the biggest side effect of the emergency contraception. Other side effects can be nausea, dizziness, bloating, headache, but those side effects are really much less frequent. So don't be surprised if you have an abnormal period. It's pretty much expected after using the Plan B. After you use the Plan B, 2 weeks later you want to do a pregnancy test. If that's negative, then the Plan B has worked. And so it's very important to follow it up with a pregnancy test after 2 weeks, and of course to use birth control or abstinence during that time.
Medtwice.com